My father's a retired cardiologist. Even as a young boy, I would go to his office and I'd get to see him practice and talk to patients. And I still remember him reading the textbook, The Heart, when I was a child. And so that really formulated the idea that I was interested in the cardiovascular process. When I came to medical school in Atlanta at Emory University, I went to gross anatomy. And I absolutely loved the dissection part, and the idea of working with the heart remained with me. The specialty of structural heart disease has really developed over the last decade or so. Ever since transcatheter valve therapies have come into play, we've started to have cardiac surgeons specialize in valve disease or structural heart disease. I'm fortunate that I've been trained in the classical surgical techniques for open sternotomy, valve disease, but also have had training for minimally invasive valve disease and transcatheter valve disease. So I guess I fell into that special window where I was able to get trained in all three techniques, and I think that provides patients with options for the management of their problems. One of my great passions is to bring research, new innovations, and technologies to not only the city of Atlanta, but to the state of Georgia and the Southeast. And I've been fortunate to not only lead some of the major trials in the past, but also currently over 5 or 6 trials in the country, but also on the executive committees for more, so that we have the opportunity here in the Southeast to have the most innovative and cutting-edge research available in the world. The Piedmont Heart Institute and the Marcus Heart and Vascular Center and the Marcus Valve Center are right in the middle of the most exciting and most innovative period for cardiac surgery and cardiovascular medicine. What we can provide for care in major surgical procedures, in minimally invasive procedures, in transcatheter procedures, specifically for valvular disease and other disease processes, really allows us to stand out as, in my opinion, one of the top 5 to 10 programs in the United States.